Hi, my name is Michael Ye. I'm an endocrine surgeon at UCLA Health. We know that undergoing an operation can be a stressful event in your lives. We want to make the process as simple and easy as possible for you and your family. Today, I want to go over some basic information about preparing for surgery. The process begins when you decide to undergo an operation after a thorough discussion with your surgeon. We encourage you to prepare and write down a list of your major questions about surgery because it is easy to forget during the visit. If you visit our website, we've also created many videos to answer the common questions that patients ask. Once you've decided to undergo an operation, our scheduler will work with you to select a date and location. We operate at 3 locations. 1, UCLA Surgery Center in the Medical Plaza 200 building in Westwood. 2, Ronald Reagan UCLA, which is the main hospital in Westwood. And 3, UCLA Santa Monica Hospital on Santa Monica Boulevard and 15th Street. Your surgeon will work with you and the scheduler on which location will best suit your needs. Once a date is set, we will double-check a few things. First, we do need to have you see your regular primary care doctor for a pre-operative history and physical to make sure you're as healthy as possible going into surgery. Patients with heart disease should also see their regular cardiologist. For patients with complex medical conditions, we will arrange for you to meet with our anesthesiology team prior to surgery for evaluation and testing. All of these items are best completed around 3 weeks prior to the surgery date. Second, we will work with your health insurance carrier to make sure you are authorized for the operation. We do not want to add any unnecessary financial stress to this process, so we aim to have all insurance issues handled well in advance of surgery. Third, you will receive a call from the operating room nursing staff the afternoon prior to your operation. During this call, they will go over what to do the evening before and morning of your operation. They will also review what time to arrive to the hospital, visitation policies, and other important information. People often ask, when do I need to stop eating and drinking before surgery? Now, this is an important point, as it is best to have an empty stomach at the time of surgery to avoid anesthesia complications. You should stop eating solid food 8 hours prior to your scheduled arrival time to the hospital or surgery center. You may continue drinking clear liquids up until 2 hours prior to your scheduled arrival time to the hospital or surgery center. Remember, anything that isn't see-through is considered solid food, so if you drink juice with pulp, any milk products, such as coffee with cream, or a smoothie within 8 hours of arrival, your operation will be either postponed or canceled. I'm sorry. Any medications can be taken with a small sip of water, ideally 2 or more hours prior to your scheduled arrival time. Another commonly asked question is when to arrive for surgery. As a general rule, patients should arrive to the hospital approximately 2 hours before the planned time for the operation. Our UCLA Health endocrine surgeons are pretty efficient, and we can sometimes run ahead of schedule. Therefore, you may be contacted to arrive a little earlier than planned. If you live more than 1 hour's drive away from the hospital, you should plan to arrive to the West Los Angeles area at least 3 hours prior to your surgery time, just in case we call you to come in sooner. Now, there's no special diet you need to stick to before surgery. Be sure to eat a healthy diet that includes lean protein so that your body has all the nutrients it needs to heal the surgical wound. And try to get 20 minutes of exercise per day to prepare your heart and lungs for surgery. One last thing. If you find yourself having second thoughts about moving forward with surgery, or if you have many lingering questions about your operation, these are signs that you might not be ready for surgery. In this case, please let our office know well in advance if possible. We will schedule a follow-up appointment or video visit with your surgeon. We hope that this has been helpful. You can always contact the Endocrine Center for any additional information. Again, I'm Michael Ye, UCLA endocrine surgeon, and thank you for watching.